afternoon, Swamiji. Thank you for having me here. It's not very often that a doctor gets to ask questions to someone with a lot of insight. We are usually at the receiving end of many questions. And one of the commonest questions that's asked is, Doctor, why did this happen to me? Someone who's never had any vices, getting cancer, or children born with illnesses. So is there some sort of spiritual meaning to something like this?
See, life is a continuation. And this life is just a continuation of many, many lives. So if you try to give any explanations of why this happened, especially when it happens in children, it can even be during pregnancy, but we don't want parents to go through guilt, etc. So what is important is that what may be the cause for why it has happened. We have to see only the immediate cause and try to help the child or the person. So many times we don't know, and even if we know, are we ready to admit? So somebody says, I'm a very good man, I'm a very charitable person, but you ask his wife, he eats tambaku all the time.
Correct.
No? Then what has cancer to do with your charity? It has to do with what provokes or invokes cancer in a person. No? Or produces cancer in a person.
We usually blame it, maybe it's your genetics or maybe it's fate, but is there some sort of karmic connection, or is there something that you sort of are paying your debts of your past life or something like that?
See, we don't only say past life. I had a chance once to interact with a group of people in Melbourne, Australia, who are trying to find methods to help people, especially in the final stages of cancer or the prevention of cancer or managing cancer. And this person himself had cancer for which one of his legs were amputated. And when it came to the next leg, he said the solution can't be this medicine which he was taking or this surgery. So he tried to find out what are the natural ways by which, and he lived for a very long time. I think he's still alive as far as I know, but he had invited me to speak and I had some discussions with him. Now there are so many causes of cancer. We cannot say there's one point of cancer. As a doctor, you know, there's pollution in the air, there are preservatives and some things, or pesticides that we are eating. We don't know all these things. And many things, many habits that we have, we do not know what is the prevention for that. And so we keep blaming it to past life, blaming it to God, or blaming it to the environment. So a better knowledge of what is the cause of cancer, that we should try to find out and find solutions, mainly is how to cure it. Now where we can't have answers, at least we can give hope, and if there is hope, of course, that, well, what is the cause? Let us not sit and grieve over it. Let us find a solution. And today there's a lot of remedies that have come up, natural as well as in modern science. Let us work on removing this cancer. Better than that. But something that in our discussions, which came out in my book, Journey into Health, because even I went through a very severe illness, not cancer, though people used to misdiagnose also sometimes and create that fear in others, and the person who just generally hears it is able to face it, but others are not. So you go through all these emotions sometimes, misdiagnoses, etc. So I knew what it is and how I cured myself. I didn't have cancer, but cured myself of something which doctors told me is incurable, it is progressive, it is and the good news is you're not going to die, but you'll suffer all your life. So it's how you take charge of your life and what is the attitude you should have. So I was speaking about that, from which they made the book Journey into Health, or transcribed it for the book Journey into Health. And one common factor is that we keep a lot of our emotions locked in. And particularly anger or self-anger, which erupts into cancer. So, and it's also seen that when people are ready to let go of that anger, and who doesn't have? People have. So, let go of that anger which has been suppressed, the treatment also works. They are able to go through the illness in a better manner and even find solutions. And sometimes we hear people go into remission almost overnight. So what is that? If further research is done, then we can definitely help people emotionally.
Thank you. That's very important and insightful for me to sort of take back. The next question is something which is very pertinent in today's generation, where everything is available at the drop of a hat. If you message something, people want instant gratification, and sometimes medicine is something that you have to give time to. So how do you manage expectations of patients?
You have to tell the patient that, listen, for you to come to this condition, you have taken years of abuse of the body, self-abuse of the body. और भगवान से क्षण में दूर करे. Yeah, you want God to remove it instantly. Without removing your habits, without removing your cause of your disease. You want just a quick fix. There should be also medicine that at least gives them immediate relief. But we must tell them that certain things do require time. It's not that all medicine requires that much time. Always it depends on you, how punctually you take your medication and what is expected out of the medication.
Thank you so much. You've really had given me a lot of clarity and answered a lot of my questions, and I hope I will translate this into better patient outcomes and better patient cares in my practice.
We need such doctors in the world.
Thank you so much. Hari Om Swami.
Hari Om.